So once that pipe is blocked, there is no blood supply to the heart and the heart starts failing. Is when a patient has a very severe block, we actually go in and open up that block and put in a stent to keep the vessel open. I don't think any other field saves as many lives as cardiology does. Most of the time, I'm in a life or death situations, life-saving procedures.
So many famous celebrities like Mr. Puneet Rajkumar and
Yeah.
Siddharth Shukla at the young age of 30 or 40, they have experienced a massive heart attack. Why do you think?
If a patient comes at night with a heart attack, I cannot say no. I, I have to get up at 2 a.m., go there, do the angiogram, do the angioplasty. So I have the work-life balance is I have to adjust, within 40 minutes, your heart muscle starts dying. So the longer you wait after 40 minutes, the more muscle death in the heart happens. So then that is why I thought, okay, this looks like dextrocardia. That is the heart is flipped. It is on the right. Should have
And
been on the left.
he's been living a normal life, sir. All this.
Indians, by their genetics itself, South Asians are, more prone for heart attack. But in general, any chest pain should be treated as heart-related pain unless it is proven to be otherwise.
Hey guys, welcome back to our show. Today we have Dr. Shahabaz, interventional cardiologist, with us. Thank you for joining us, sir.
Thank you.
Can you introduce yourself to our audience, sir?
Yeah, I'm Dr. Shahabaz Patel. I'm an interventional cardiologist, currently working at City Super Specialty Center and Center Care Hospital, Belgaum, Karnataka.
Oh, that's nice, sir. Where did you do your undergraduation and post-graduation?
So I did my MBBS from BIMS, Belgaum, and then MD from JGM Davangere. And then I did my DM cardiology from Amrita Institute, Kochi, Kerala.
Oh, that's a very renowned institute. So totally how many years of coaching, sir?
So 5.5 years of MBBS, then 3 years of MD, then 3 years of DM. So yeah, some 8, 12, 13 years. And then I took 1 year
13
off in
years.
between. Yeah, so 14 years. Yeah.
What kept you going for studying more? What was that craving or hunger you had that you had to keep studying further?
It's just that you want to learn more. See, the thing was, always wanted to be a doctor. Then I went into
Yeah.
MBBS. Then during MBBS, I realized, okay, this is not enough. Maybe I should do MD. Then during MD, I was like, okay, why not go one step further? Because then I really liked cardiology. So I thought, okay, why not go into cardiology? So it was just like wanting to learn more, wanting to do better. That was the whole thing that, kept me going. That is what it was basically.
You always wanted to take up medicine, sir?
Medicine, yes. Medicine from my school is I kind of always wanted to be a doctor. But then
Okay.
like once you go into MBBS, you realize whether you want to go to surgery in medicine. Then I always leaned towards medicine. So then that's why I went into medicine. Then after medicine, I was like, okay, fine. I was into cardiology a lot. So then I was like, okay, why not do it? That was the thing. So
You would
cardiology,
have come across.
my field also, it's like it's very different from all the other medical fields. It's like an instant gratification thing. You open the block, patient survives. It's a life saving. Most of the time, I'm in a life or death situations, life saving procedures. So we are actually at high stress, high risk, high payoff kind of. You high risk situation, but if you do well, you kind of get that satisfaction also. So I'm always in that high stress situations. So I don't think any other field saves as many lives as cardiology does. So we are in those situations. So if you are like that sort of personality or that sort of thinking, then maybe you'll definitely enjoy cardiology. Yeah. So
So, if you
I-
had to explain what you do on a day-to-day basis to a non-medico, what would you say how
so
your job is?
so my job is very varied compared to any other medical specialty or subspecialty because usually medicine is all about seeing OPDs and wards. But in cardiology, it's not like that. Cardiology, I see OPD, then I go do some echoes, then I go to ECG, read some ECGs, then I go to the cath lab and I do angiograms, then I go to the ICU, see some patients in the ICU. So it is like in one day, I basically go through the entire hospital. So I go to the OPD, go to the ICU, go to the ward, do echoes, do angiograms, do angioplasties. So my days
Very great.
starts early, ends late, and it is all across the hospital doing a lot of varied roles. So that is where it is very different from the usual specialties where it is just OPD ward, you know, OT.
Is
So we
it
have to.
is it justified if I ask, is there a personal life balance in cardiology?
You have to make one basically. That is that is the answer I would say. So that is basically in your hands.
Hmm.
If I want to work, I can really work 24 hours.
Hmm.
That is basically in your. You have to make your own work-life balance because yeah, work is always obviously kind of never ending sometimes. But then, uh, if a patient comes at night with a heart attack, I cannot say no. I I have to get up at 2 a.m., go there, do the angiogram, do the
Hmm.
angioplasty. So I have the work-life balance is I have to adjust. I have
You
to make my
draw
own.
boundaries.
Yeah, make my own work-life balance. That's what how things are.
So you mentioned that you like see the OPDs, go to cath labs, everything. This must require you to be so physically fit. How do you maintain that? Like
Uh,
you must be on your feet the whole day.
so that is what 3 years of training does to you now. So once you get into cardiology residency, it's basically it is
Hmm.
a very hectic residency. Maybe like I don't know, I maybe the most hectic residency in all the medical
Hmm.
specialties at least. So we and Amrita Institute where I did was a really good hospital with a
Yes.
very heavy cardiac workload. So for 3 years we have been trained to work like this. No, trained to handle patients, handle that kind of stress.
Hmm.
And then we were in Amrita Hospital where I worked was a huge hospital. It's a huge hospital, so we had to run from one end of the hospital to the other end. Initially, it was tough, but then you kind of get into the flow
You
and you
get
get used
used
to
to it.
it. Yeah. So that's what that the training prepares you for it basically.
So when there is an heart attack, this is like a
Yeah.
basic question everyone asks to any doctor or
Okay.
cardiologist, maybe.
Okay.
So can you just tell in basic words what is an
Yeah.
heart attack and
Okay.
what we should do? What are the signs we should look for?
Okay, so yeah, so let me explain this in detail actually. So
Okay. Yeah.
basically, your heart is a muscle. Okay, so
Huh.
it's a muscle that starts working before you are born. It continuously pumps blood till you die. So no rest.
Huh.
It does not even stop work for 1 second in your entire life. So it is
Huh.
probably the hardest working muscle in your body. So with that kind of work, it
Hmm.
needs a lot of nutrients, not needs a lot of oxygen, needs a lot of blood. So it needs a lot of blood supply to keep it working and keep it pumping. So this blood is supplied to the heart by three vessels or three pipes that supply blood
Okay.
to the heart. This blood carries oxygen and energy that the heart requires. So
Hmm. Hmm.
basically, what happens is over time, as you get older, due to various
Hmm.
reasons, smoking, high blood pressure, diabetes, that is a different. But due to various reasons, these pipes they get clogged.
Hmm.
What
Hmm.
happens is a wax-like substance. It's a waxy substance called cholesterol. So this
Hmm. Hmm.
kind of start depositing inside the pipes. So
Okay.
the pipes of your heart keep getting narrower and narrower. It's like your kitchen pipes getting rusted or getting clogged with grease. It's the same thing. The
Hmm. Hmm.
pipes in your heart keep getting clogged. And
Hmm.
then one fine day, what happens? This waxy substance, that is a plaque, it ruptures. So once it
Okay.
ruptures, there's a clot formation. The blood clots in the pipe. So
Hmm.
once the blood is clotted, this pipe gets completely blocked now. There is no blood going through that pipe. The pipe is completely blocked. So the heart does not get oxygen. The heart does not get energy.
Hmm. Hmm.
So once you cut off the oxygen, so suppose you cut off the oxygen to your hand
Hmm.
dies, it falls off. The same thing happens. So once that pipe gets blocked, your heart muscle starts dying. So
Hmm.
within 20 to 40 minutes of the pipe to your heart getting blocked, or the vessel to your heart getting blocked, the heart muscle itself starts dying. So that is what a heart attack is. So
Okay.
basically, it's the clogging of the vessel that supplies the heart, or clogging of the pipe that supplies the heart. So this is in
Okay.
basic terms what a heart attack is. So once that pipe is blocked, there is no blood supply to the heart, and the heart starts failing.
So, why is it often told that when you're experiencing any heart symptoms or chest pain, you should hurry to
Mhm.
the hospital? Why is that always stressed upon? Why
Yeah.
is
So
there a time factor?
yeah. So yes, that is one important thing. Like I told right now. So basically, what happens is in a heart attack, the
Hmm.
blood supply to your heart is cut off. Your heart is
Okay.
not getting any oxygen, any energy, any nutrients.
Hmm.
So basically, it is not it. You need oxygen to survive, but now with the
Hmm.
blood supply cut off to your heart is deprived of oxygen.
Hmm.
So once the blood supply is cut off, within 40 minutes, your heart
Hmm.
muscle starts dying. So the longer you wait after 40 minutes, the more muscle death in the heart happens. That is why
Okay.
it is very important to reach a hospital and open up that blocked vessel as soon as possible. So if you do it within 40 minutes or within 2 hours of your chest pain, so
Hmm.
you can actually save all of the heart muscle. So there will be
So
minimal
that
to
is a
no damage.
golden period you're saying,
Yeah,
sir?
yeah,
40
that
minutes
is
or
the
two
good.
hours?
2 hours. Yeah, that is the golden period. So even after that, at the as soon as we open up that vessel, the more heart muscle we save. So this will help in the long term. So suppose if a
Hmm.
patient comes a long time after chest pain, where the heart muscle, a large part of his heart muscle is already dead. So we open up the blood vessel, but then majority of the muscle must be already dead by that time. So
Okay.
there are long term effects. The pumping of the heart, the function of the heart declines. So the
Hmm.
sooner
Hmm.
you open up the heart muscle, the block, the more muscle we save, and better is the outcomes long term.
Okay.
So that is the we preserve more function, more muscle. That
Hmm.
will
Hmm.
lead
Hmm.
to a better quality of life later. Even if the patient has had a heart attack now, but he
Hmm.
reaches the hospital fast, and we open up the vessel fast, he will have
Hmm.
a good long term outcomes in the sense that one is life saving, another
Hmm.
thing is quality of life. Quality of life will be
Okay.
good because the heart function will be preserved.
Hmm.
So he
Hmm.
will
Hmm.
have a very good quality of life. So that is why it is very important to reach the hospital early.
Early, is it? Sir,
Yeah.
is every chest pain a heart attack, sir?
So no. So every chest pain not is not necessarily heart attack. Chest pain can be due to a variety of reasons. It can be
Hmm.
due to sometimes GERD or gastritis can mimic chest pain. There can
Hmm.
be muscular pain in the chest. There can be costochondritis, that is rib pain. That is inflammation of the ribs can cause chest pain.
Hmm. Hmm. Hmm.
Or there can be lung issues called as pleuritis that can also cause chest pain. So there are a
Okay.
variety of things other than heart which can cause chest pain. But any severe sudden onset chest pain should be treated as heart related unless it is proven otherwise, because
Hmm.
that
Hmm.
is how dangerous heart attack is.
Okay.
But if you ask me if any chest pain or heart pain, is there any chest pain related to the heart? No. So
Hmm. Hmm.
generally we say that suppose if the chest pain is more of a dull aching type, or it increases when you climb stairs, it increases if you walk a certain distance, then it is more likely to be related to the heart. But if the
Hmm.
chest
Hmm.
pain is more of a pricking type of pain, more localized, where the patient can point to the pain with one finger, then it is probably not a heart related pain. If the patient has pain more on in when lying down on one position, or more on taking a deep breath, then most likely it is not a heart related pain.
Okay.
But in general, any chest pain should be treated as heart related pain unless it is proven to be otherwise. So that is the dictum. Yeah.
Suppose now, sir, an intern is
Okay.
there in the casualty all by himself,
Okay.
and there's a patient who comes with chest pain. He wants to call his senior. What
Okay.
is that one thing that he should do? He's not sure if he should just discharge with the pantoprazole injection, or he should go ahead with ECG or echo. What should he do? Like,
So first of all, any chest pain that is coming, if you are an intern and any chest pain comes to the
hmm,
casualty, first of all is to get an ECG. So
okay,
type of pain, when the pain started, everything else second. First thing to do is to get an ECG, because that
hmm,
will tell you a lot,
hmm,
whether it is a heart related pain, whether it is an emergency, whether you can wait, whether to inform your seniors. So that one ECG can give you a lot of information. So if any
hmm,
patient comes to the casualty with chest pain, the first thing to do is to get an ECG. So that
okay.
itself will give you a lot of information.
Can stress cause heart attacks, sir?
Can stress cause heart attacks? Definitely yes. So through various mechanisms. Once there is chronic stress in the sense like chronic stress leads to more junk food binging. So
Okay.
it alters your cholesterol metabolism. So it leads to high cholesterol levels. Then it
Hmm,
leads to sleeplessness or insomnia. So you get
hmm,
lower sleep. So lesser sleep is again associated with heart. heart disease. And then chronic stress can lead to high blood pressure and diabetes, which in turn can cause heart related problems. So in these
Okay.
ways, I think stress can lead to heart related problems. Definitely, yes.
So nowadays, if you observe the trend, so many famous celebrities like Mr. Puneet Rajkumar and
Wow.
Siddharth Shukla, at the young age of 30 or 40, they have
Yeah.
experienced a massive heart attack. Why do you think this is happening, sir?
So there are a lot of factors here, but the main core risk factors that cause heart disease
Uh,
have been the same. It will be the same even 50 years from now. But the main thing that has changed now is the
uh,
lifestyle. So if you look
the
at a
lifestyle.
30-year-old in 1950s and if you look at a 30-year-old in 2020, in 1950s, most of the
Uh,
jobs were physical. Most of the jobs were outdoors. Nowadays, most of the jobs are desk related jobs. So we are sitting on a chair for 8 to 10 hours a day. So that
uh,
sedentary lifestyle and plus the food, all these food delivery apps and everything, we are exposed to a lot of junk foods compared to 50 years back. So that one, so one is
mm.
sedentary lifestyle, one is the kind of food that we're eating. Also, stress levels have definitely gone up, I think. So financial stress, job stress, family stress, whatever. So all these things, these are the known risk factors which were known even 50 years back. It's just that you know uh, things have changed. The jobs
Okay.
have become more sedentary. We have more access to junk food. Stress levels have gone up, and obviously, again, Indians by their genetics itself, South Asians are more prone for heart attacks. So the genetics also play a role, but the lifestyle plays an even greater role than genetics. So definitely, so all these things combined, we are having heart disease in younger populations now compared to 50 years back, I think.
So often everyone in my family asks, like they get a routine complete blood count test or
Okay.
a GRBS or something like that every once a year. They always
Okay.
ask me what should we do to check our heart functions and when should we start that.
Okay.
So,
So there are various, I don't want to get into technicalities, but then there are various guidelines given by associations such as American Heart Association or European Society of Cardiology. So according to these guidelines,
hmm,
if you are more than 25 years of age, you
okay,
need to get your ECG done at least every 3 years, even if you are completely normal. So
okay,
even if you don't have any, suppose if you have one risk factor like you are diabetic or you're hypertensive or you're smoking
uh,
or somebody in your family has heart disease, that also is a risk factor. So then you need to get your ECG done yearly and you need
okay,
to get your cholesterol levels checked every 3 years, even if you do not have any symptoms or risk factors. But if you have any risk factors such as high blood pressure, high sugar, or family history of
hmm,
somebody in your family has heart, then you need to check your cholesterol levels yearly. And the
okay,
third thing is a treadmill test. A treadmill test every 3 years after
uh,
the age of 40,
uh,
especially if you have risk factors such as somebody in your family having heart disease, or you have high blood pressure, or you smoke, or you have high blood sugars. So any of these risk factors, you need to get a treadmill test once a year. You need to get an
okay.
ECG once a year, and you need to check your cholesterol. So these are the three tests which can help you screen for heart disease and detect it early.
That was a very nice sum up, sir.
Mm.
Can you also tell the difference between angiography and angioplasty?
Yeah, so angiography is basically when we inject a dye into the blood vessels of the heart and we take a
Mm,
photo of the heart or a video through a machine called a fluoroscopy machine. So we get a
okay,
photo of the blood vessels of your heart. So this is just a diagnostic procedure, meaning we are not doing anything to improve the patient. We are just checking where the blocks are. So basically, it gives you a snapshot of your blood vessels. So then we
mm-hmm.
can look at the photo and we can determine where the blocks are, how many blocks are there, whether there are two blocks, three blocks, and we can even tell the severity of the blocks, that how much percentage of block is there, whether the
Okay,
patient has a 40% block or a 60% block or a 70% block. So we can diagnose. This is like the Supreme Court test. This is a final test. There is no test
okay,
better than angiography to detect heart blocks. So
okay,
this
sir.
is like the final. So it will give you a final answer whether the patient has blocks, how many blocks he has, where the
Mhm.
blocks are, and how severe the blocks are. This is like the final test to answer all these questions. This is what
Okay.
angiography is. So angioplasty is a procedure. In
Mhm.
angioplasty is when a patient has a very severe block, we
Hmm.
actually go in and open up that block and put in a stent to keep the vessel open. So this is a therapeutic procedure. That is, we are treating the patient. Here we are actually treating the block. We're opening up the blood vessel and putting a stent in. So that is what is called angioplasty. Whereas
Okay.
angiography is only taking a photo of your blood vessels.
Photo, is it?
Yeah.
So when do you say that I cannot treat this? Like you just have to visit the cardiothoracic surgeon for the further
Mhm.
intervention. When do
So
you take that
again,
call?
yeah, yeah. This is again there are very various guidelines for this again. So it
Hmm.
depends from guidelines to guidelines, but there are guidelines given by the American Heart Association as well as European Society of Cardiology that most of the cardiologists follow. So in general, if there are many blocks,
Hmm.
generally your heart has three main blood vessels or three main
Okay.
pipes that carry oxygen to your heart. Three main blood. So if there are blocks in all three blood vessels,
Hmm.
then that is usually when we refer to cardiologist because it will be too many stents. Too many stents
Hmm.
also is not a good thing. So if there are blocks in all three vessels, then generally we refer to a cardiothoracic surgeon for a bypass surgery. Or
Okay.
or if
Hmm.
the block is very high up in the main, that is called the left main blood vessel or the left main artery. So the
Hmm.
main vessel of the heart itself has a block. Then doing an angioplasty in that case can become a very risky procedure. You know, it becomes a very high risk procedure then. So in that case also we sometimes prefer bypass surgery over angioplasty. So
Okay.
yeah, so that is the two. Then there are various other conditions such as sometimes the patient will have too much calcium in the heart. So in that,
Hmm.
if the patient has too much calcium, calcium sits like a rock. So my stent will not open. So if I try to open
Okay.
up the blood vessel with a balloon, it will not open because the calcium acts like a rock. So in
Hmm.
that case, again, sometimes I will have to refer the patient for a bypass surgery and
Hmm.
not go ahead with angioplasty.
So also you had explained about one case which you came across. I read about
Mm.
that article, dextrocardia.
Yeah.
Can you please
Yeah.
elaborate?
So this was, I think, a 65 or 70-year-old farmer. Basically, he came to the casualty with a chest pain. He was sweating profusely. Then we took an ECG. So
Hmm.
at that time, we didn't know he had a right-sided heart. So dextrocardia is basically a heart which should be normally on the left side, was on the right side. So we took an
Okay.
ECG. It showed ST elevation, that is signs of a massive heart attack.
Hmm.
But then the pattern was not the usual pattern that we usually see. So
Hmm.
then I was like, okay, this patient is having a heart attack, but the ECG does not seems weird.
Hmm.
Then then I examined him closely, looked for heart sound. Then I could find heart sound on the right side of the chest. So
Oh.
then that is why I thought, okay, this looks like dextrocardia. That is, the heart is flipped. It is on the right. Should have
And
been on the left.
he's been living a normal life, sir, all this while. And
He's been living a normal
oh.
life. So he didn't know that he had a right-sided heart. Then I just ordered an immediate bedside X-ray first. So
Hmm.
that confirmed that the heart was on the right side. So anyways, he was having a heart attack in a right-sided heart. So we
Hmm.
had
Hmm.
to go ahead with angioplasty because he was having a massive heart attack.
Oh,
So
it
then
must have
we,
been challenging, no, sir, because everything will be mirror
yeah,
image then.
yes, yes. So we took him to the cath lab. So angioplasty generally we can go through the hand, through the
Hmm.
radial artery, or through the leg. Through the hand is more gets more challenging. But then in this case, because the uh, heart was in the right, I went
Hmm.
through his leg. So
Hmm. Hmm.
then
Hmm.
once I got into her heart, yes, the orientation was a little different because I'm usually used to left-sided hearts.
Yeah, left
So
side.
the orientation was a little bit different, but then I had a very good cat team, technicians and all, and intensivists. So we were able to navigate through all that, and then finally reach the block vessel, and then we identified the vessel that was blocked, and then we successfully opened it up. He's doing well now. Actually, he had come for a
Oh, that's
3 month
really
follow up.
great, sir.
Yeah.
Also, sir, you have been doing research on a lipoprotein, if I'm not wrong.
Yeah,
Uh,
yeah. It's called LPA.
hmm.
Yeah, it's called lipoprotein A that has been shown. It has been shown to be a very high risk molecule. So the scary thing about a lipoprotein A or LPA, it is basically a type of cholesterol. So when you talk about cholesterol, there are different types of cholesterol in the body. So one is the
Hmm.
good cholesterol called the HDL cholesterol. One is the bad cholesterol called the LDL cholesterol. Then that there are triglycerides which are also bad for you. Then there are some other types of cholesterol. So LPA
Mm.
is also a type of cholesterol. But then what is different with this is genetically determined. This is not because of your food. You if that means that LPA will be determined by your genetics. So if your grandparents, parents had high LPA, you will have high LPA no matter what you eat. So genetics is what determines this type of cholesterol. So and this has been linked to heart disease recently, and
Okay.
there are a few labs which are doing it now. So generally, most of the labs, if you look at them, generally your LPA level should be less than 30. So they have
Mm-hmm.
done various studies in some people who in whom the LPA levels are more than 100. If your LPA
Mm.
level is more than 100, then your risk of having heart disease is 5 to 6 times that of a normal person.
Oh my
So
God.
that is a
Okay.
very high risk. So that means your risk is elevated 500%. So that is how strongly linked to heart attacks this new type of cholesterol is that they have identified. But the scary thing again is it is not linked to your diet. You cannot lower it by eating healthy. You cannot lower it by exercise. And there is no therapies for it currently. There are some
Okay.
injections which lower it like modestly. And they, by the end of this year or beginning of next year, we are looking forward to having new drugs which can lower this. But currently in
Okay.
2026, we do not have any therapy
Mm.
that can actually lower this type of cholesterol. So this is a very high risk factor. So I am
Okay.
getting it regularly tested, especially for my patients in whom there is a strong family history, or some patients who have repeated heart attacks. So they have a
Mm.
heart attack now, and then 5 years down the line, they develop a new block. So in such kind
Mm-hmm.
of patients, I get an LPA done. Or in patients who have a very bad family history, their parents had heart disease, their uncles have heart disease. So in
Mm.
these people, it is very important to do an LPA test. So
Okay,
if
sir.
so if your LPA comes high, that means you are genetically programmed to have heart disease. So
Mm.
then you need to control all the other factors, because we cannot control LPA right now. There is no therapy for it now, but then we can control all the other factors that can cause heart disease. So that is
Mm.
how the treatment goes.
Sir, is there
Uh,
any correlation between PCOS and thyroid illness, sir?
Not directly, but then
Mm.
yes, because PCOS causes insulin resistance, which can lead
Okay.
to diabetes, and diabetes itself, causes heart disease, and
Mm.
PCOS causes weight gain and
Mm.
alters your cholesterol metabolism. So
Okay.
through that mechanism, it can cause your
Mm.
LDL, the bad cholesterol, to go high. It completely alters your cholesterol metabolism. So then in
Mm.
that way, it can lead to heart disease, yes. But PCOS as a disease directly affecting the heart, no. So it will increase your risk of heart disease by causing insulin resistance, by increasing your weight, by altering your cholesterol metabolisms. So
Mm.
indirectly, it does increase your risk of getting a heart disease. Yes.
What about thyroid illness, sir? Its
Thyroid,
correlation with.
thyroid also the same thing. Indirectly, it can increase
Mm.
your heart disease risk, because thyroid is known to alter cholesterol metabolism. So
Okay.
generally, what happens in thyroid is the triglycerides will go up. So your
Mm.
cholesterol metabolism is altered. So then that can lead to plaque formation and clogging of the pipes in the heart, and then that can lead to a heart attack. So that is how thyroid can affect indirectly. Yes.
So this question or this statement, everyone is very much making it generalized that cardiologists earn a lot. Is it actually real, or is it just people are just hyping it up in India at least? Do you really
I
think cardiologists are sitting on a gold mine right now?
It's not all cardiologists earn a lot. I don't earn a lot. So it's like saying all cricketers earn a lot. Virat Kohli will earn a lot, but not somebody who's playing Ranji or something like that. So again, you have various levels. So that is
Mm,
true for any field. So if you are doing
mm.
really really well in your field, then you probably earn a lot. But if you're average, then you probably earn average. It's like that. That is true for
What
all fields.
what would the average be, sir? Just a generalized quote.
average pay for a cardiologist, it again it depends on if you're in North India, if you're in South India, if you are in the metro, or if you are in a tier 2 city,
Like
tier 3
tier 1
city.
city or a tier 3 city like
So
that?
tier 1 cities generally starting pay is lower. So it
Hmm.
starts at around 2.5, 2 to 2.5 a month, I think, in tier
Hmm.
1 cities in
Okay.
South India at least. In North
Hmm.
India, salaries are higher. So as you go towards the periphery, salaries tend to get higher. So if you are in tier 2, tier 3, it is probably higher. But tier 1 city in South India, probably you will start off with 2 to 2.5 lakhs per month.
Is it because of
2
the
lakhs per month.
competition, sir? Because too many people are there?
Yeah, that is one of the factors. Tier 1 cities
Hmm.
already have a lot of cardiologists. So, so then maybe that is why. So tier 1 city, you will start off maybe at 2 per month, 2 lakhs per month.
Hmm.
But then you keep going up, and as you gain more experience, it keeps on increasing. Tier 2 cities and tier 3 cities, you earn slightly more. Yeah.
If you have to sum up for this Gen Z generation, sir, how to take care of their heart, what would you suggest?
This question has been asked to me many times. So
Yeah.
I just so all you have to do is take care of your ABCDEs. That is what I say. So A is your A1C or HbA1c level should be less
Okay.
than 7. B is
Hmm.
for blood pressure less than 130 by 80. C is
Hmm.
for cholesterol less than 70. D is for do not smoke. And E is for exercise at least 20 minutes of walking per day. So that is the ABCDE that you need to follow. That's it. That is all you need to do basically. You don't have to do.
That
It's
is
not
so
rocket.
apt,
It's not.
sir.
It's not rocket science. Yeah.
Thank you so much, sir.
Okay.
Thank you so much for this very informative podcast. I'm very sure
Okay.
everyone will understand in a nutshell how the heart works, what they need to do on a day to day basis to take good care of it. Thank you for
Okay.
this.
Thank you. Thank you so much.